Hi there, thank you for joining me today. Over the next few minutes, I'll be taking you through a product overview of the systems that we provide to our customers. Here we're looking at the Care Control Care Planning area, which sits at the heart of the system that fully supports digital person-centred care. Each service user has a single care plan made up of configurable domains, allowing providers to structure plans around their service, their residents, and their regulatory requirements. The care plans are clearly laid out and easy to navigate, with authorised staff able to access them through desktop, tablet or mobile applications. Within each domain, staff can store structured information alongside free text, ensuring care is both consistent and personalised. Plans can include guidance, risks, outcomes and support strategies, helping staff understand not what just to do, but why. Care plans can be updated at the time to support continuous care, with care review dates clearly visible to help maintain compliance. Where required, changes can follow an approval process supporting governance and audit control. All updates are recorded in a full audit trail showing who made the changes and when. Overall, Care Control brings care planning together into one clear, compliant and easy to use digital care record. Moving into the HR section within Care Control, which brings staff records, compliance and people management into the same systems as care delivery. All staff are held in a central, secure register, giving managers a clear overview of their workspace in one place. Each record supports both day-to-day management and regulatory requirements. Within an individual's staff profile, managers can record key employment information, role details and documentation, creating a single source of truth for each staff member. Important documents such as contracts, training certificates and compliance records can be uploaded and stored securely against each profile. Expiry dates and required checks are clearly visible, helping teams stay on top of compliance without relying on spreadsheets or paper files. Training and certifications can also be tracked within the system, making it easier to monitor staff readiness, identifying gaps and demonstrate compliance during inspections. Supervision notes, appraisals and staff goals can also be recorded, supporting ongoing development and good workforce management. Where relevant, managers can view staff activity. Within Care Control's Insights area, we bring together data across the system to give managers clear, meaningful oversight. The dashboard provides an at-a-glance view of key information across individuals, services, and the wider organisation. Insights are grouped into areas such as care delivery, incidents, behaviour, health, and staff activity, making it easy to focus on what matters most. Data is displayed through visual charts and trends, helping patterns, reoccurring issues and emerging risks stand out. Because information feeds directly from daily notes, incidents and monitoring, Insights always reflects live, real-world data. Care Control Insights turns everyday care data into clear, actionable and supporting safer control informed by decision making. Here we're looking at the rostering section within Care Control, which supports clear, flexible scheduling while staying closely linked to care delivery. The roster provides an at-a-glance view of staff shifts, service users and coverage, making it easy for managers to see who is working, where and when. Rosters can be viewed by day or across longer periods, helping teams plan ahead while responding to day-to-day care challenges. Shifts can be created and updated quickly within clear assignments to staff, times and responsibilities, helping reduce errors and last-minute confusion. Rostering links directly to care delivery, ensuring the right staff are scheduled to support the right people with visibility of planned activity. Managers can take staff availability and working limits into account, supporting safer scheduling and helping reduce the risk of burnout or missed care. The system highlights gaps or potential issues, allowing managers to address problems early rather than discovering them after the fact. Staff can view their rotas clearly, reducing the need for printed schedules or separate systems and help everyone stay aligned. Rostering data also feeds into wider reporting and oversight, supporting operational decision making. By keeping rostering within the same system as care records and oversight, Care Control helps reduce duplication, improve visibility, and support consistent, well-planned care. Here we're looking at the consolidated invoicing area within Care Control, which brings together care delivery and finance into one joined-up process. This area gives managers a clear overview of invoices, helping track what's been delivered, what's been billed, and what is outstanding. Invoices are generated from the care and the rostering data held within the system, reducing the need for manual calculations or duplicate entry. Multiple entries can be consolidated into a single invoice, making billing clearer for both providers and commissioners. Invoices can be linked to individual service users, placements, or contracts, supporting accurate and auditable billing. Users can filter by date ranges or periods to review specific billing cycles or respond to financial queries. Where required, invoices can be reviewed and adjusted before being finalised, ensuring accuracy and reducing the risk of disputes. Because invoices are directly linked to the back of the care record, there is a clear audit trail demonstrating exactly what has been delivered and billed. By connecting invoices directly to care delivery, Care Control helps reduce admin, improve accuracy, and give financial teams confidence in their billing. Let's take a look at the CRM area now within Care Control, which helps organisations manage relationships, communication, and key information from central inquiries. The CRM provides an overview of contacts and relationships, making it easier to see who you're working with and what interactions have taken place before the pre-assessment. Each record brings together relevant details, notes, and interactions, creating a clear history that supports the continuity and informed conversations. Calls, meetings, and updates can be logged against each record, helping the teams keep track of conversations and next steps without having to rely on separate tools. Records can be updated to reflect current status or stage, helping teams understand progress and prioritise follow-up activity. Relevant documents and information can be linked directly to records, keeping everything organised and easy to find. Search and filters make it simple to locate specific contracts or review recent activity quickly. Access can be controlled by role, ensuring information is visible only to those that need to be maintaining oversight. By keeping relationship management within the same platform as care, workforce, and finance, Care Control helps reduce duplication and keeps everything connected. And finally, let's take a look at the payroll area within Care Control, which brings together worked time, rostering, and pay information into one consistent process. This section gives managers a clear overview of payroll periods, helping track to see what's been worked, what is ready to process, and what has already been completed. Payroll is generated directly from approved rosters and recorded time, reducing manual calculations and improving accuracy. Managers can view pay details at individual staff level, making it easier to check hours, shifts, enhancements, and total hours paid before payroll is finalised. Built-in checks and approvals support confidence before processing, helping to reduce errors and reworks. Payroll information can be exported in the format suitable for processing, supporting integration with external payroll providers where required. Because payroll links directly back to rostering and recorded time, there is a clear audit trail showing exactly how pay has been calculated. By keeping payroll connected to rostering and time worked, Care Control helps streamline payroll processes, reduce administrative work, and improve confidence in payroll accuracy.